Some healthcare announcements are pretty simple. The government breaks ground on a new hospital, a hospital purchases a new CT scanner, a health clinic hires more nurse practitioners. This next segment is not about anything that simple. In fact, this week's announcement by the Ontario government about healthcare restructuring may be the most consequential development in half a century, but it's complicated. So we've invited the Minister of Health and Long-Term Care to go through the details so we can better understand how these changes will affect the care you get. And with that, we welcome Christine Elliott, who's also the MPP for Newmarket Aurora, to our studios again, and it's nice to have you here.
Thank you. Pleasure to be here.
Just before we get into the nitty-gritty and all the details, can we start with this? What is the problem that you were trying to solve with the announcement that you made this week?
The problem is with respect to patient care. It's not connected. People feel isolated from their healthcare experience, and they feel that when they leave a hospital, for example, and they are supposed to be connected with home care, that doesn't happen in every circumstance, with the result that many people end up back in hospital again because of complications, because they don't receive home care in a timely manner. People are not happy. I heard that during my time as opposition critic for health, during my 2 years as patient ombudsman, and certainly I've heard a lot about it since I've been Minister of Health and Long-Term Care.
You're not a newcomer to the health file, right?
No, I'm not.
Yeah. Health critic,
Yeah.
patient ombudsman, health minister.
Yes.
Gotcha. We're going to take a moment here and go through all this. So Sheldon, let's go through all these graphics here, because the province of Ontario is now creating a new centralized agency called Ontario Health that will consolidate the missions of many other agencies. For example, Cancer Care Ontario and eHealth and the local health integration networks. They're all now under one roof called Ontario Health. They're also going to create Ontario Health teams comprised of healthcare providers, that's hospitals, family doctors, home care organizations, that, as the minister has suggested, will function as one seamless caregiving team. And the government expects to have 30 to 50 Ontario Health teams with 300,000 patients apiece in 3 years' time. The Ontario Health teams will be expected to use digital technology so patients can have access to their records, and that crucial information will follow the patients throughout their healthcare journey. You may, for example, also be able to book appointments online. A new emphasis on virtual care is there, so you may not have to physically visit your doctor or specialist, and you can be assessed by video interface, for example, where appropriate. And the government says any savings realized from more efficient administration will be invested back into care. Now, you've heard the former Deputy Minister of Health, Bob Bell, describe this as possibly the biggest restructuring and the most significant change brought into the Ministry of Health in half a century.
Yes.
What makes it so?
Well, there are many, many parts to this, of course. We want to make sure that we center care on patients. We want to modernize our technology to have virtual care, to allow people to have access to their own medical records. We need to take down some of the silos that exist for provider funding for healthcare providers, because they each get funding in separate envelopes with separate goals and missions. Sometimes they contradict each other. So there's lots of changes that have to be made internally for this to provide that seamless care experience for patients.
Let's do a real-life example here.
Yes.
Let's say somebody frail, elderly, is in the hospital, has a procedure, recovers to the extent that they can in hospital, and then presumably is discharged to go home and needs follow-up home care.
Yes.
How will the new processes that you're now putting in place deal with that patient journey?
Well, what happens now is often by the time that patient is discharged, they don't know who is going to provide the home care, when they're going to arrive, and what care they will be providing. From the provider's side of things, the home care nurse wouldn't know much about the patient's history, what their circumstances are, and what care needs to be provided. Under the new system, by the time the person is discharged from hospital, in many cases, they would already have met the nurse that's going to be coming to their home. If they haven't done that, they at least know who's coming, when, and they can be assured that the provider, the nurse, is going to know about their history and will know what care to provide them with and make sure they have the right equipment and whatever else they need in order to provide that care. So it's a connected system from one end to the other. And from the provider's perspective, the nurse, for example, they will be connected back to the hospital again, so that if complications arise, they can speak with the physician, the surgeon, whoever it happened to be, to find out what needs to be done. And that care can be provided to that person in their own home so that they don't end up back in hospital again. It's really centered around the patient. All of the providers are connected to their care. Everybody has a role to play, but it's about the patient experience, making sure we have better health outcomes and better patient satisfaction.
Okay, I thought, though, that when the Liberals, the previous Liberal administrations, created the LHINs, the Local Health Integration Networks, that the whole idea was to have this one central organization integrate all your care from beginning to middle to end.
Yes.
Was that not happening?
That was not happening at all. We heard from many, many patients. That was the biggest issue that I heard about during my time as patient ombudsman, that people were not happy at transition points from hospital to home care or hospital to long-term care. That's continued since I've been minister. So we've been examining the ways that we can fix that to change things. And we came up with the plan that we did because it was clear to me that we can't just make incremental change around the edges. That's what we've been doing for years and years and years in healthcare, and it hasn't produced the results that we need. We need this transformational change, and that's why we're embarking on it.
Now, don't take this the wrong way, but with all due respect, I have heard many people say that this government is not great at consulting. And, you know, we can make a list of the issues that are out there where the government has made its decisions without, in the view of many, adequately consulting. Have you adequately consulted all of the people who are necessary to make this work and ensure that they're on side?
Yes, I can tell you that I have consulted over the years because I have been involved. I'm not a healthcare practitioner, but I was involved as health critic for 6 years, 2 years as patient ombudsman, and now in my role as minister. And that is those consultations have been ongoing for many, many years. But we did specifically consult with the Ontario Medical Association, the Ontario Hospital Association, Home Care Ontario, Registered Nurses of Association, and many other organizations about this plan. And I'm very encouraged by how receptive they are to this plan and how they want to get started.
Did you consult Patients Canada?
I did, yes.
Okay, I didn't know that, but you having said that, I now have to declare in the interest of full disclosure, I think my wife's on the board of Patients Canada, so I should put that on the table right now. We have an agency in Ontario now called Cancer Care Ontario, and they are supposed to be a pretty good organization because the story goes they're able to laser-like focus on dealing with cancer-related issues.
Yes.
You're now going to take that organization and you're going to fold it into this bigger agency. Why should we think that that's a better way to deal with cancer if it's part of a much bigger organization as opposed to being on its own where it can focus laser-like on the problem?
Yes. Well, I think there is a little bit of confusion about that, and I appreciate the opportunity to clarify, because Cancer Care Ontario is going to continue to do their work with the great people that they have there. It just means that their board of directors now will be Ontario Health, as it will be for the other agencies that are being moved in, and for the health provider teams as they're ultimately constituted locally. So Cancer Care Ontario will keep doing their work, and any patients with cancer concerns need not worry at all, because we think that Cancer Care Ontario is one of the best in the world for cancer care provision, management, looking at best practices, bringing forward new procedures and so on. Also for renal indications, they're doing great work. That can be a model for a chronic disease management strategy for other areas that don't have that kind of laser focus. Diabetes, for example, could probably use the Cancer Care Ontario model, and certainly mental health and addictions doesn't really have much of an infrastructure at all. That is something that they could use Cancer Care Ontario as a model, and it's something that we're focusing on as a government as well.
I don't have to tell you that not everybody agrees with what you just said, and perhaps the most notable exception to that, and he's actually, he's got an op-ed in the Toronto Star today. He's had one in the past. He's been all over radio and television. Former Deputy Minister of Health, Dr. Bob Bell, who's been around healthcare a very long time. I heard him say the other day he likes the overarching vision that you have brought out, but of course he thinks you're on the wrong track and that implementation will be far more problematic than you're letting on. What do you say to that?
Well, of course, I respect Dr. Bell very much, but we do have a difference of opinion on this issue. I feel very strongly that this plan is what we need to bring forward in Ontario. We do have an opportunity, and I would say, well, clearly a responsibility to the people of Ontario to provide them with excellent quality connected care. And so we do need to bring forward this transformational change. Just a few small changes here and there, while it might be easy for us to do, is not going to bring about the results that we need. So we are prepared to take it on. We have people working long and hard on this. It's not something that we're just bringing forward because we thought that would be nice and wrote it on the back of an envelope. Not at all. We know that this is significant change. We know that the implementation is going to be important. In many ways, the work is just beginning, and I'm prepared to put in that work. So is our entire team at the ministry to make sure that this is successful for the people of Ontario.
Dr. Bell has also talked about political interference that concerns him. And obviously, if you're going to put, 19 or 20 agencies all into this new, I know you don't like me calling it a super agency because that was in the leaked document, but for lack of a better expression, this new big thing called Ontario Health, the CEO of that organization is going to be a really powerful player in healthcare.
Yes.
And the board of this new organization will have significant responsibilities for vast, far-reaching areas of healthcare. And I think Dr. Bell has made the point that, are these going to be staffed with former, defeated Tory candidates or friends of the Premier or that kind of thing, or are they going to be people who've got expertise in the field?
Well, they will absolutely be experts in the field, I can assure you.
You're committing to that?
I'm totally committing to that. In fact, we have third-party assistance with an outside organization bringing candidates forward to us that do have that experience. They are being interviewed by members of my staff, by the Deputy Minister, and they are being credentialed, and we are assuring the people of Ontario that the people who will be sitting on this agency will be people who have the knowledge and the expertise to make sure that this job is done properly.
You make the board appointments, I presume, right?
Ultimately, I sign off on them, but I can tell you I have not been involved personally in the interviews because I think it is really important that this be done with the assistance of the outside provider and that the candidates are chosen based on their merit.
Okay.
And then the members of the agency, once they are finally chosen and the board is complete, they will be the ones that will hire the CEO.
Which you will sign off on but not pick, is that right?
That's correct,
okay.
Yes.
Got it. Here's I guess a strange little example, but I guess I understand how this is all going to work if you live in a particular city or town in the province of Ontario and you need health care in that city and town in which you live. Let's say you're traveling or you're on vacation or you're at the cottage, so you technically aren't in the place in which you typically live. Will there be a change to the way you access care going forward?
Well, first of all, yes, you will be able to access your own personal health record. So that will apply whether you're traveling in Ontario or in other countries. That is really important because it is your record. You should have access to it, all of the people of Ontario. What my hope is that will help people become more responsible for their own care, be more proactive about attending tests that they need to attend, take the medications they're supposed to take, and so on, and they'll be able to see how they're progressing. But as well, the local health providers will also be able to help connect them to care in other communities if they are reassigned for work, for example, for a period of time, that they will be able to connect the care from the one local health team to the other to make sure that the experience is seamless for the patient.
Okay. We should also put on the table here the notion that the opposition have brought forward numerous times during the whole course of the rollout on this, and that is they've looked at the documentation that sets up this new organization, and in their view, it opens the door to increasing privatization and procurement of private sector companies in the procurement of services in the healthcare system. Is that true?
No. It is absolutely not true. What is going to happen going forward as the local health providers come together and make an application to become a local Ontario Health team, they will be scrutinized. So it may be a local hospital, perhaps a home care provider, and a mental health service provider. They come together, they decide they will make an application to Ontario Health to become a local Ontario Health team. They will then, if they're accepted, they will then be given an allocation of funds for the provision of care within their geographic area, if that's the way that they're applying. And that applies to all of the health providers, not just them, but all of the health providers. But they will be responsible both on a fiscal basis, on a quality of care basis, and on the basis of ensuring that patients and families and caregivers are still involved in the decision-making with respect to what's happening locally in care to proceed. So that will be one funding allocation. If there is any money left at the end of the year, that money will then be pushed directly into healthcare for the next year. It will not be divided up amongst those agencies. That will go towards the provision of care for the entire community for the next year.
You've heard critics also say that this is essentially, at the end of the day, a play to have less administration of healthcare, more money towards frontline services, and that the expectation is that, once it's fully implemented, hundreds, if not thousands of people, fewer, will be working in this system. Jobs will be lost. Can you speak to that?
I have heard that, but that is not the point of this transformation. The point, why we are doing it, is to center care around patients and to make sure that they are supported and their care is connected throughout their lives. Whatever time, whenever they need health care, that they should know that their healthcare system is ready for them. So there'll be one number to call and no gaps. We want to make sure that we can actually put more people on the front lines in our healthcare system. And the people that are already there in the local health integration networks, for example, that provide home care, nurses, personal support workers, we still need them. We want to have more of them out there to provide home care. So it's a reorganization really within the structure around patients that we're talking about.
Does anything in that reorganization take anything away from the single-payer nature of our system, or allow people to jump the queue or use, if they have more financial means, use that ability in the healthcare system?
No, there is nothing in the legislation that would allow that to happen. People will continue to pay for their healthcare services using their OHIP card, as they always have, and no one will be able to jump ahead in line because they have more money than others. That's not what our healthcare system was designed for. I believe strongly in our public healthcare system. That's what makes us all proud Ontarians, and we want to continue that.
The Premier is big on customer service.
Yes.
I know he is, and his late brother, they're legendary for their phone calls to follow up on customer service. If people have problems with this new system as you are restructuring it, who do they complain to?
They can ultimately complain to me.
Well, not everybody can call the Minister of Health and get the Minister of Health on the phone. So.
Well, they can certainly make a complaint through the Ministry of Health, and they can make it to our office. Our contact information is on the Ministry of Health website. They can certainly let us know what their feelings are about the system, how they feel we are doing, because we need to know that. This is going to be a transformation that is going to take several years, because we want it to be seamless for patients. So we will not be handing care over to a local Ontario Health teams until we can be assured they are ready to take on that mantle, and that they can assure us that patients' care will continue on an uninterrupted basis.
You used to be the patient ombudsman, obviously.
Yes.
Has that role been filled now that you're no longer occupying it?
The executive director is still filling that role, but that role will absolutely continue. I am committed to the Patient Ombudsman's Office, as well as to the Premier's Advisory Council on Healthcare. That is a group of people who are patients or former patients who have healthcare experience, who provide me with advice and guidance from the patient's perspective. And if we're building a patient-centered system, we absolutely need that to continue.
Okay. In our remaining moments here, I want to read, Greg Sorbera, the former Minister of Finance in Ontario. He's got a letter in the Globe and Mail today. He says, years from now, a newly elected Ontario government will announce, with much fanfare, a dramatic new approach to healthcare. It will consist of a regional/local delivery model that is patient-focused and eliminates a bloated, centralized bureaucracy. File under, quote, the circle of life and take it to the bank. That's Greg Cerbera in the Globe and Mail today. You know, I'm not a cynic on this, but I've been around long enough to see that it was the NDP 30 years ago who brought in multi-service agencies, and then the Conservatives came in under Mike Harris, and they became the Community Care Access Centers, CCACs. Then the Liberals came in, and in 2006, they created the LHINs, the Local Health Integration Networks, and the whole idea, every step of the way, was to restructure and reform healthcare to make it work better for the patient. And now here you are again, reinventing yet again. So why should we have confidence that this is the right mix?
Because the status quo is no longer acceptable. We're seeing major strains now in our healthcare system. We've got 30,000 people waiting for long-term care bed placement. We've got 1,000 people every day receiving care in hospital hallways and storage rooms. We've got thousands of people waiting for mental health and addiction services. And if you're a parent of a child who's expressing suicidal thoughts, to be told that you have to wait a year for service, that's not acceptable. I cannot stand for that.
So that will end under this new
As Minister of
system.
Health, we are going to reduce those wait times. We are going to bring forward a comprehensive mental health and addiction service. And so while many governments have planned changes that are going to center around the patient, we are redesigning the entire system around the patient, and that's what makes it a fundamental change and difference. And that's why I am confident that our plan is going to be successful.
So the days of hallway medicine are over. People are not going to be waiting on cots in the hallway.
It's going to take a little while, but we are going to end it. This plan will help bring that forward, because if we have a comprehensive system for chronic disease management, and we can help people with mental health and addictions problems stay out of our emergency departments, because many of them cycle in and out, that reduces the number of people in hospitals. If we can keep people in home care to recover and not come back because they have complications, that reduces the number of people in hallways in hospitals. So every step along the way, we are working at that, and that is how we are going to end hallway healthcare.
That's Christine Elliott. She's the MPP for Newmarket Aurora, also Deputy Premier, also Minister of Health of Long-Term Care, and we're grateful for your visiting us at TVO tonight. Thanks so much.
Great pleasure. Thank you.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario, helping businesses stay on the right side of change with strategic thinking, insightful decisions, and business leadership. Are you on the right side of change? Ask an Ontario CPA.